Good morning, good afternoon, good evening. My name is Dr. Abdikadir Islamia Toluwatoyin, Dr. Mia. Yeah, today I'll be talking about something you all know. Yes, you know about it, but do you really know how much you need to know about this thing? No, because most of us we've heard it so many times. In fact, if you don't have it, maybe your parent has it, or maybe someone in your neighborhood has this thing, and this disease is called diabetes. We all know what diabetes is, but do we really know how much we need to know so that we can tackle this disease? No, we don't. And that is why I'm talking about diabetes today. So sit there and listen to me attentively and learn much about your diabetes and how you can handle your diabetes. I'll be doing two videos, part 1 and part 2. So in this part, I'll be explaining what diabetes is. And another thing we don't get is people believe, oh, I don't have fever, I don't have headache, I don't have abdominal pain. So why should I go to the hospital to treat my diabetes? I look healthy. We need to know that the damage or the damages diabetes cause is so much more than we can think of. The complications of this disease is what kills faster than the disease itself. And that is why we need to know details about diabetes and how we need to treat our diabetes. Trust me, if you don't have it, that doesn't mean you can't have it later on in life. And even if you don't have it, listening to this video helps you save someone out there. So what is diabetes? Diabetes is the increase in glucose level in the bloodstream. Glucose, I mean sugar. So alternatively, we use glucose as sugar too, like we change it, glucose, sugar. So when there is much glucose level in the body, then you have diabetes. Okay, how do you get glucose in the body? When we eat, the end product of what we eat, like we learned, mostly rice, amala or gari, the end product is always glucose because the body uses glucose for its metabolism and its activity. Now that we are fasting, because we eat less, at this time we are expected to have low glucose in our bloodstream, which is known as hypoglycemia. So I would give you an illustration about how the body uses glucose. Like maybe when I eat rice now or when I eat eba now, my body breaks down this food into glucose, which is the end product. Now, for the body to use this glucose to gain energy, it enters the body cells. You know, the body is made up of cells. So each cell in the body uses glucose. Now, this glucose, how does it enter the body cells? It's like an illustration of a key and a door. The door is the opening to the cell, as in it's like the barrier between the bloodstream and the inner part of the cell. So when you eat and you have glucose in the bloodstream, the door opens and glucose moves into the bloodstream, from the bloodstream into the cell, for the cell to use it. So there is a key to this door. Now the key to this door is known as insulin. So when there is glucose in the bloodstream, the insulin, which is the key, opens the door to the cell, and the glucose moves from the bloodstream into the cell for the cell to utilize it. That is how you gain energy. Without that formula, you can't utilize, or you can't even do anything, you can't even be active. So when the body is unable to take up this glucose, maybe the door is faulty or the key is faulty, then the cell is unable to take up this glucose from the bloodstream. That is when you develop diabetes, which means the glucose in the bloodstream is much more than normal, and then the cell doesn't have access to glucose, then you become weak. That is the major formula for or how diabetes occurs in the body. And then it's common among older people. Like we have different type of diabetes. We have the type 1 diabetes, we have the type 2 diabetes, we have diabetes secondary to so many diseases. Still, the type 1 diabetes occurs maybe from childhood, while the type 2 diabetes occurs majorly in adults, like old people. And what happens here is that the producer of this key, which is insulin, which is the pancreas, The pancreas produces insulin. So the pancreas does not secrete much insulin, or the insulin itself is not active. It's like when you have the key that doesn't suit in the hole, in the door hole, or the keyhole in the door, then the door won't open. So if you have the insulin that doesn't fit to the door, to the cell, then you don't expect the door to open. Do you understand me? So that is how glucose gets much in the bloodstream. And yeah, what are the causes? There's so many causes of diabetes, but we have genetical type. Like maybe, for instance, if your parent has diabetes, you might be prone to having diabetes later in the future. And also we have environmental factors, maybe some diseases also. Maybe, for instance, people who have endocrine disease could have diabetes, or people who have renal disease could have diabetes. Those are the major causes. But type 2 majorly is genetical. And also there are risk factors of developing diabetes. The risk factor, like as usual, you have overweight or obesity, and also hypertension is a risk factor of having diabetes. I think you're following me and you can understand me. Now, when you go to the hospital and the doctor checks your sugar level in the body, there are some values that you need to know. Importantly, when the value of the sugar in your body is more than 11, that is when you have diabetes. That is 11 millimole. But if it is between 7.9 to 10.99 millimole, then you have pre-diabetes. That is, you are prone to having diabetes in future. But when it is more than 11 millimole, then you have diabetes, and that is the fasting blood sugar. Fasting blood sugar, which simply means you've not taken anything maybe for the past 6-8 hours or 7 hours before the test is being done. Now, what I want you all to do now is go to the hospital today, tomorrow, or anytime, and know your diabetic status. Do this favor to yourself. In my next video, you would know, and you will get to know the complications and why you need to treat this disease. So many people are amputated today. So many people, they don't have legs. Why? Because of diabetes. Why? Because they've neglected the treatment of diabetes. Some people are blind today because they neglected their diabetic treatment. But you know, you look healthy, you look beautiful, you look so clean. Trust me, the damages diabetes is causing in your body is not very obvious from the outside. But from within, you're not healthy. So do me a favor today. Go to the nearest hospital nearby and just tell them, oh doctor, please, I want to do my random blood sugar. I just want to do it. And I want to know my diabetic status. Just let me know. You don't even need to draw a lot of blood. No, just a pinprick would tell us if you're diabetic or not. And from there, you can handle this disease at the early stage. And from there, you can take care of yourself. Remember, if you're diabetic, does not mean the world is coming to an end. Just make sure you treat yourself so well. Because if you don't take care of yourself, no one will take care of you. And if you're gone, you might think you're irreplaceable. But seriously, you are replaceable. And the world will continue to work. The world goes on. So kindly go to the nearest hospital today and know your diabetic status. Yes. Thank you so much. And in my next video, I'll come and tell you the complications, the signs and symptoms, and what you need to do if you're diabetic. But today, my awareness, I'm creating awareness of knowing if you're diabetic or not. Don't tell me you're good. Diabetes is for people that are old. Just try and know if you're diabetic today. Thank you so much. And watch this video, share it, like it, and make comments, please. Because you're not only helping yourself, you're helping everyone out there too if they listen to this video or if they watch this video. And like I said, you can drop your comments or suggestions or questions. Thank you so much. And once again, I am Dr. Abdulkadir Islam Meeyah. See ya.